Welcome to the Common Sensibility Podcast, where we break down real financial decisions with clarity, confidence, and common sense right here in Oklahoma. Okay, we are here with a good friend of mine, Chrissy, with St. Francis Children's Hospital. And we're going to talk about the reason we're here is Red Crown Credit Union has made a new partnership with the hospital. We're going to talk about that, but we're also just going to talk about the hospital in general and why it's important to the Tulsa community, but not only the Tulsa community, but the Oklahoma community, and how this hospital saves children's lives every day, every week, every month, every year, and why that's so important. So, welcome, Christy. How are you?
Yeah, I'm great. Happy to
Good.
be here.
I'm good. I'm good. Thank you. Um, so first off, give us a little background about yourself, what you have done at the hospital, and a couple of things like that.
Okay. Well, so my name's Christy Streeter, and I'm a Tulsa native. I was born here. I was actually born at St. Francis. And I've worked for the health system for over 25 years in different capacities. And for 21 of those years, I've been at the Children's Hospital. So my role right now is the Children's Miracle Network Program Director, and I'm going on 3 years of being in that role. And I love St. Francis. Like I said, I was born there. I had my 3 children there. My youngest son was a patient and as an infant, so I have a lot of experiences, and started my first job there. So I had an internship there, first job. I love the mission of the hospital, and our mission is to care for the sick and injured just as Jesus did, and I feel like the staff believes this, and they're doing everything they can to provide that kind of treatment for our patients and families. So I believe in the system, in the hospital system.
That's amazing. It's so cool to have someone that is a embodiment of where they work, not only as a person that's lived it for so long, but that believes in the mission. So happy to hear that. So give us a little education on the hospital and what are the expertise and why is it important that we have a children's hospital here in Tulsa?
Okay. Well, the expertise is treat the treatment of children and in a medical setting. You know, children are different from adults, and they need pediatric specialists who are educated and trained on childhood illnesses and how to treat them. And children require special equipment compared to the equipment that is used to treat adults. And for example, our ventilators, our small ventilators that we use in our neonatal intensive care unit for our premature babies. That's just one example of several. And why it's necessary for there to be a separate children's hospital and versus then being treated in an adult environment.
So with that you just stated about the NICU, is that the most common treated condition? Are newborns, or is it children that are older that may have had accidents, or children that are older that may unfortunately have some sort of disease?
Well, so we're 160 bed capacity. We treat babies, age 0 through age 18. Our neonatal intensive care unit has 50 beds and is pretty much full year round. So I would say that's definitely a large part of our population that we see all types of conditions, such as medical emergencies like appendectomies or motor vehicle accidents, to longer care patients and populations like cancer, heart abnormalities, cystic fibrosis, and then we treat mental illness as well.
Okay. Yeah, that's it's crazy to think about all of the complexities. Me starting my career and working with credit unions for kids 18 years ago, you really only think about, little babies born prematurely, and that's what the hospital does. But then once you realize it, there's so many more uh, dramatic things like car accidents, motorcycle accidents, or kids on a four wheeler 4th of July accident that they need to be rushed to the hospital. You just don't think about that. So the great segue there. What would probably be some of the biggest misconceptions about children's hospitals?
I feel like a big misconception is that children's hospitals do not need community support, when in reality they do. They need the support of donations, grants, and the community. And many families in children's hospitals are underinsured or on Medicaid, and neither of these cover all of the costs of the patient care. And pediatric care is expensive with specialized equipment, like I mentioned, specialized staff. We have pediatric specialists that are trained for children and in the smaller patient volumes compared to our adult hospitals. So, donations, grants, community support, they often fund the parts of care that insurance don't cover.
So to segue off of that, the parts of care is that, and maybe you don't know this, but does that cover the cost of a hospital bill, or is that more covering the services and expertise that the hospital is needing to keep great staff and keep up to date with technology?
Probably a little bit of all of that. And I do feel like the majority of our outside funds go towards charitable care. So, an example is maybe a family is staying at the children's hospital for several days or even months. We had some premature babies that are born at the hospital and they stay 100 days. And so, a caregiver may need to take a leave of absence from work. And we have a meal program that our funds will support at the St. Francis Children's Hospital and to provide meals for these families, which is a huge essential part, their well being in the hospital. And another example, if a child needs to go home with specialized equipment like an oxygen machine, and they don't have the means to pay for that, then we've got those funds to support that as well. So equipment and charitable care, our child life department, and we support our child life department, which I'm not sure if you're familiar with what a child life specialist does. We have 9 of them at St. Francis Children's Hospital. And to me, in my experience there, child life specialists are critical at children's hospitals. And they're trained health professionals, they're trained in child development, and they help children and families cope with the emotional and psychological challenges of illness, injury, disability, hospitalization, and medical procedures. Um, they focus on reducing fear, stress, and trauma for kids that are in the hospital. They prepare kids for the many procedures that they may have to go through using an age appropriate language and provide therapeutic play and family education. So it's a lot that their job encompasses. But in a nutshell, it's to make the experience for the child just kid friendly. And there's all sorts of programs that they're over, like our pet therapy program that brings in dogs pretty much 7 days a week to visit these children. And they've got superheroes that can visit. They've got special events all throughout the year, Christmas parties, trick or treating at Halloween, Easter egg hunts at Easter. So they plan the special events for these kids and try to make it as normal of a situation as they can while they're in the hospital.
I bet. I bet you that's another tough thing for a family to grasp and realize is, it's not a normal, and you don't want that to be the normal life of a child, especially in their adolescence and learning about their life and learning about society. Uh, that's tough, but that's awesome that you all do that. So talking about the financial needs that the general public doesn't realize, you all work, I'm assuming, of course, with just general donations from individuals and things like that. But we also have corporate partners. One of your corporate partners is, I think, is the best corporate partner, which is Credit Unions for Kids, established here in Oklahoma in 1998. Um, for the 2 hospitals in Oklahoma, Credit Unions for Kids has raised over, I believe, $2.5 million. Not as much to the Tulsa Hospital because you've only been around since 2007, 2008.
2008, I'm 16 years old. So, about 2008? 2008.
I'm terrible at math.
I
Sorry,
too.
don't ask me that.
But we are 16 years old. We just celebrated our sweet 16,
Awesome.
being in that freestanding facility. Before the hospital, we were level 5 at the main hospital, the adult hospital.
Correct. So tell us about some of your corporate partners, like who they are. And if you have the numbers off the top of your head, can you tell us roughly what was donated this last year? You've got any of that information?
Yeah. So, like I said, I'm the work for the Children's Miracle Network, and St. Francis is one of 170 children's hospitals across the nation that are a part of this network. And Children's Miracle Network has national corporate partners that raise money for their local children's hospitals. So I have 12 national corporate partners that are a part of CMN in Northeast Oklahoma that are active in raising support for the children's hospital. And basically, these different businesses do campaigns all throughout the year, different times of the year. They may look like a roundup at the register or a percentage of sales donation. Special events like golf tournaments, pickleball tournaments, they can be creative as they want to be to raise support for the hospital. And since I've had this position, our support has risen each year. And this last year in 2025, between our national corporate partners with CNN and our local businesses, 913,000 was raised.
Wow.
So we're really, yeah, that's something to celebrate. Really excited about that. And our local partners, we've got just a few. That's something that I'm actually working on, just reaching out to the community. And basically, those are local businesses that raise support for the Children's Hospital. So,
Awesome. That is so if you're a business owner out there, please consider this organization because it of course is a great need and a great thing for our community. So you had said that some of the organizations, they do golf tournaments and 5Ks and marathons and things like that. And one of the uh one of the reasons we're here today is we're talking about our partnership and unfortunately right now Lynn Crown doesn't have the resources or probably the manpower to put on a big event to raise big amounts of money. I've seen credit unions in Oklahoma raise upwards of $60,000 in one year. Um, they are larger credit unions, more resources. And then there are small credit unions that raise $1,000. Right now, we're kinda in that ten to $15,000 range, um, but what we've done to try to surpass that is that we've created the St. Francis Children's Hospital debit card, the first one, for this hospital. It is not exclusive, so any other banks or credit unions wants to follow in our footsteps to raise more money, I challenge you to do so. Ours will be prettier, of course, so what do you think, or what are you hoping that this debit card that we've created and it's taken us 2 years to put together? What is your hope for the impact of this card?
well, first of all, I want to say thank you because I'm so excited about this card. And not only is it pink and cute, but I just think the potential it has to raise awareness and support for the Children's Hospital is going to be great. What I did not mention earlier is every donation from our national partners through CNN and our local partners do stay local. I want to be sure I mention that. Um, and yeah, the impact with the debit card and just to increase both awareness and support for the Children's Hospital. I'd like the support to showcase our Child Life program. I mean, we've got, so many other entities that are supported. And maybe this is just a personal bias that to me, our Child Life program is very critical in the role that they play in the children and families in our hospital. So I would love to impact that department as much as we could.
Well, good to know, 'cause, that'll be something that we'll put on our list of things of as we're building this brand connection, and working with your team over at the hospital, how we can tell the story through this card, that will be something that we'll keep in mind. Okay, this has gone, faster than I expected, which is great, but, so we just have just really one more closing question. So what does the future of the hospital look like? And then what are your hopes and dreams for the next, 5, 10, 20 years that you want this hospital to inspire to?
Well, I feel like it's got a bright future. I mean, no place is perfect. Every place has their flaws, but I feel like St. Francis, just the health system in general, it just gets bigger and better every year. Our leadership is amazing and it's just making some amazing difference um, in Northeast Oklahoma. And I just hope that I hope the children's hospital just continues to be the best, one of the best in Oklahoma, with pediatric specialists who can provide the greatest treatment for kids in our community and for it to be a safe place just for everybody that experiences it.
I hope the same. I'm glad that you all are here. I'm glad that Tulsa has something that we can be proud of, taking care of our future. I mean, that's what it is, and that's what you all do. And that's why I'm gonna speak for myself. That's why I'm so um connected to it. 18 years ago, I was like, what is credit unions for kids and why does it matter? And 18 years later, I hopefully am one of your biggest champions. So I want to thank you for coming in. I want to thank you for helping us bring this partnership closer and more engaged. And I am excited for the future of what we can do together, not only as a credit union and as a hospital, but as a true partnership with credit unions for kids. So thank you again.
Well, thank you. And one thing I want to mention, and this is for you, this is for your associates, any of your clients. I'm happy to provide hospital tours, tours of the Children's Hospital. It's one of my favorite things to do. I'm so proud of it. And I think it's neat and important for people who are supporting it to see where their support is going in person. So if anybody wants to do that, just send them my way.
Okay, you heard it. You heard it here first. So stop in the hospital, get your little ID badge. Yes, do that for security reasons, and then we can get you on a tour. So thank you again for coming. If you guys ever want to make any type of donation to the hospital, I'm sure they can go on your website or they can visit the hospital and make a donation there. Correct?
Yes, thank you.
Okay. Well, thank you all for listening to the Common Sensibility podcast, and we'll talk to you next time.
A few quick updates from Red Crown Credit Union. Wills for Wishes Car Show is coming up on May 16th at the Pryor Tigers football stadium. This is a car show supporting Make-A-Wish Oklahoma with classic cars and family fun. Auto loan rates as low as 4.99% APR for up to 72 months. Visit redcrowncu.org for more information. Rates and terms are subject to change. Thanks for listening to Common Sensibility. Subscribe, share this episode, and send us your questions for future shows. Until next time, keep building clarity one decision at a time.